The prostate is divided into some lobes. Okay, let us see what are they. So here in this diagram, just have a look on this diagram. You can see the urinary, this is a prostatic urethra. Anterior to prostatic urethra, we have the anterior lobe. On either side, we have lateral lobe. Just behind, we have the median lobe, and there is posterior lobe. Okay, so you are seeing the sagittal section. So here we have you are seeing the two lateral lobes of the prostate glands. Okay, this is the anterior, so lateral view, anterior surface and the posterior surface. The idea is at the posterior surface we have the seminal vesicles are there. Seminal vesicles. The seminal vesicle, duct of the seminal vesicle traverses the this prostate gland and finally opens into the prostatic urethra. This is the prostatic urethra. Okay, that is the posterior part is divided by two areas by the duct of seminal vesicle. Okay, the area above is known as the median lobe, and the area below is the posterior lobe. So totally how many lobes we have? We have 5 lobes. There is anterior lobe, 2 lateral lobes, then we have the median lobe and the posterior lobes. Now see the anterior lobe. You can see this is the anterior, this is posterior. Anterior lobe is located in front of the prostatic urethra. Remember, this is a non-glandular part. This anterior lobe does not have any glandular tissue. Okay, you can see there is no glandular tissue present over here, and it is normally called as the isthmus. The meaning of isthmus is the connecting structure. Isthmus is the something which is connecting together. Okay, so isthmus is the anterior lobe is also known as isthmus, and remember anterior lobe is non-glandular. Now posterior lobe. Okay, here you are seeing the prostate gland. Here is the seminal vesicle, duct of seminal vesicle. So this is the median lobe and this is the posterior lobe. You can see the posterior lobe is present below and behind the ejaculatory duct. This is the ejaculatory duct, below and behind the ejaculatory duct. And one thing you should remember, the primary carcinoma of the prostate gland starts in the posterior lobe. So the importance of the posterior lobe is primary carcinoma originates here in the posterior lobe. Now coming to the lateral lobes. I already told you there are 2 lateral lobes are there, and these lateral lobes lies on either side of the prostatic urethra, and anteriorly these 2 lateral lobes are connected by means of isthmus. That is known as the isthmus, connected by isthmus. Now very important is the median lobe. Okay, where you can see the median lobe. So here in this diagram you can see the posterior surface. We have the seminal vesicle here we have the ejaculatory duct. The part of the lobe lies above and in front of the ejaculatory duct is known as it constitutes the median lobe. Okay, and you can see that the median lobe, it projects into the posterior aspect of the urinary bladder. Okay, creates an eminence at the apex of the trigonum vesicae, and it is known as a uvula vesicae. Again, the median lobe projects into the urinary bladder and creates a ridge-like structure. Is known as a urethral crust, crista urethralis or verumontanum. Remember this importance. It is having importance. Verumontanum. What exactly is the verumontanum? This particular median lobe. Okay, median lobe projects into the posterior aspect of the urinary bladder, creates a ridge over there. Okay, so this is the ridge. You are seeing this ridge over here. Okay, so this ridge is the verumontanum or the urethral crest. And this median lobe consists of most of the glandular tissue. Okay, and it is a site of adenoma. Adenoma is the non-cancerous growth of glandular tissue, is known as the adenoma. So 2 things to remember: the median lobe is a site of adenoma and the posterior lobe is a site of origin of carcinoma. Now, so here again you can see this was the median lobe. So the median lobe makes a projection over there. Okay, there is a projection. Okay, and below the projection there is a crest, urethral crest. You are seeing a projection called uvula vesicae, and below the uvula vesicae there is the verumontanum. Okay, so this verumontanum or the uvula vesicae is produced by the median lobe. Produced by the median lobe. Median lobe. Now, what are the zones of prostate? Okay, so surgeon normally consider the zones rather than the lobes of the prostate gland. What are the zones of prostate gland? Let's see. There are four zones are there. So first one is a transitional zone, where you can see the transitional zone, it is surrounding the prostatic urethra. The area surrounding the prostatic urethra is known as the transitional zone, which constitute about 5% of the glandular tissue, or the glandular tissue of the prostate is divided into four zones. The first one is a transitional zone. The glandular tissue, the area around the prostatic urethra is the transitional zone. Then coming to the central zone. The area surrounds the right and left ejaculatory duct. We have two ejaculatory ducts, right and left. That area surrounding forms the central zone. Central zone. It constitutes about 25% of the glandular tissue. 25% of the glandular tissue. Next one is the peripheral zone. So you can see, just look at the peripheral zone. So peripheral zone, okay, it constitutes about 70% of the glandular tissue present in the peripheral zone. Okay, where you can see it is present in the posterior aspects as well as the lateral aspect of the prostate gland. Posterior as well as two lateral part occupies the peripheral zone. It constitute the center, or it includes the central zone and part of the transitional zone. Central zone, the whole of the central zone, and the part of the transitional zone is coming in the peripheral zone. And there is anterior zone. Anterior zone, you know, there is an anterior lobe which is non-glandular, okay, where you can see only some smooth muscle fibers and urethral sphincter. Smooth muscle fiber and urethral sphincter is present in the anterior zone. So these are the zones of prostatic glands. Okay, so what are they? We have the four zones are there: transitional zone, central zone, peripheral zone, and anterior zone. So tell me, what is the transitional zone? Where you can see transitional zone is constituting only 5% of the glands, and it surrounds the prostatic urethra. And the central zone is the area around the ejaculatory duct, and the peripheral zone about 70% constituted by the posterior as well as the lateral part of the gland, which includes the central zone and the part of the transitional zone, and there is an anterior zone or anterior region which is non-glandular.